welcome everybody to our webinar this evening. And thank you for being here. Want to welcome Representative Laura Hall from Alabama. She's on our executive board. Miss Laura Hall, Representative Laura Hall.
Yes, thank you so much. It's good to be here. Thanks for the invitation.
All right, welcome. We're gonna open up with prayer by our chaplain of AALSCC, Miss Dory Henry.
Thank you, Madam President. Can you hear me?
I hear you. Mm-hmm.
Okay. Heavenly Father, thank you for every person that is here on the Zoom call today, for each and every mind and heart that feels the presence of this room. We thank you. And only you know what we are setting out to accomplish this evening. We have ideas and visions and talents and abilities. However, only you can see in your perfect detail the end of every beginning. Every project, every season, every life, nothing is ever in vain, for even we make mistakes and missteps, but they are all used for good. Strengthen our confidence in who you made us to be, Lord Jesus. Set us free from competition in order to work together efficiently. Bless this meeting this evening, all those present, as well as the lives of those we will touch after the meeting is over with. In Jesus' name we pray. Amen.
Amen. Amen. Again, want to welcome everybody and thank you for taking the time out of your busy schedules. I know if you're like me, you're zoomed out one, and you seem to be probably a little bit more busy now that you are sheltered in versus being in the office. So we appreciate you joining us tonight. I see Miss Tanisha Woods has joined us. I'm gonna, before Tanisha speaks, I am the chair of AALSCC. We are the staff committee for the National Black Caucus of State Legislators. And we want to take the time to thank our members and President Cobb Hunter for their continued support, as well as our corporate roundtable. I did invite a few of them, but they weren't able to attend, but we want to thank them for continuing to support AALSCC and the other staff members. And I want to introduce our officers. We have our vice chair, which is Tanisha Woods.
Hi, everyone.
Good afternoon. Good evening. We have our chaplain, which is already spoken, Dora Henry.
Good evening, everyone, once again.
And we have Allison Sneed, our special projects manager. And she's also a former chair of AALSCC.
Okay, can you hear me now?
Yes.
Thank you. Welcome. It's a pleasure to be on the call with everybody, to be on the Zoom with everyone.
Good to see you. Good to see you. We're going to go ahead and get started because we're really excited to have Dr. Michelle Laws, who's joining us this evening. And I'm going to let her tell a little bit about herself. I am having technical difficulties. I'm on two computers right now. My other one just blacked out. So if she doesn't mind telling us a little bit about herself. Michelle.
Oh, sure. And thank you, Shauna, and all of the members of NBCSL. I am honored to be with you tonight. And it was truly an honor to get the invitation during this particular time. I am Dr. Michelle Laws. I currently work directly under the Secretary for the Department of Health and Human Services for North Carolina, Dr. Mandy Cohen. I am one of the Assistant Deputy Directors over Consumer Policy and Community Engagement for the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. Have spent my career in one capacity or another in policy and research, and also some time on the human rights and civil rights side of things, but really as a public servant in one capacity or another. And I also have trained, received my doctorate at VCU in the School of Medicine. So I heard that there was someone from Virginia on today, and spent quite a bit of time there while I was in the med school program there, going down the PhD track. And so really am a huge supporter of many of the members there that I had an opportunity to meet at different events and functions that the university sponsored. And so again, really just honored to be here during this time and to share a little bit about self-care for public servants in particular, and people who are in this space of serving the public during a pandemic in particular. So glad to be here. I think that's enough. I mean, just quite a bit more that I could add, but I think that's probably.
Well, thank you. Thank you so much. You can go ahead and start your presentation.
Okay.
Yeah. Mm-hmm.
So I think we're going to, I want to thank Mr. Roach for the technical assistance, and those of you who can see the screen. Again, tonight, what I want to focus on is minding your mental health, our mental health, while serving the public. And Sean and I talked a little bit about how this presentation could be most impactful. And so I've tried to put a little bit of what we talked about into the presentation, but certainly at the end, we'll welcome and like your feedback and your contributions as well. Next slide. I really want to start first with what I'm calling the facts of the matter, or really the heart of the matter that places us, especially during a pandemic such as the COVID-19 pandemic, that places us, those of us who are African Americans or Blacks, at particular risk, high risk for not only contracting COVID-19, but also of deaths. And so we've heard what some of the risk factors are, and I'll talk about those. But in general, when we look across the spectrum of chronic health conditions and diseases, when we look at longevity in terms of life expectancy, there are some things that I think are particularly important to highlight tonight as I go through this presentation. And one is that compared to non-Hispanic whites, when we look at African Americans ages 18 to 49, we're 2 times more likely to die from heart disease than whites. And then when we look at the age group between 35 and 64, African Americans are 50% more likely to have high blood pressure or hypertension. And my research background and area of expertise, and where I started building my scholarship while at VCU in the School of Medicine working on my doctorate, was looking at cardiovascular disease risk among African American women. And one thing I'm going to highlight tonight is the impact or the influence or an effect of stress. And when you combine that with some of these other chronic health conditions and diseases, it sort of sets up a perfect storm for us to always be at higher risk for mortality and morbidity across pandemics. And I'll unpack that a little bit. We're more likely to die as African Americans at early ages from all causes. And then when we look at, just based on 2017 life projections of life expectancy, you can see the table at the bottom. When we look at white males, the average life expectancy is 76 years of age, white females 81. And then when you compare that to Black males, 71.9 to 72 or 71 for Black males, and 78.5 or 79 is the average life expectancy for Black females. And then, of course, you can also compare that to Hispanic and non-Hispanic whites, which is higher anytime you pull out the Hispanic population out of the white category. And we can think of factors, social determinants. We can think of historical factors. We can, trace this directly to the long-standing and ongoing effects of slavery and of racism and other types of inequities. Next slide. When we think about our mental health in relationship to the context for tonight, we can also see some disparate effects and outcomes. Go back. We can also see some disparate effects and outcomes or disparities. So among the adult population of Blacks, we are 20% more likely to report serious psychological distress than adult whites, right? So my grandmother used to say, if it ain't one thing, it's another, right? Or every time I turn around, there's something going on. And so this ongoing psychological distress. And I remember some years ago, attending a legislative Congressional Black Caucus Brain Trust on mental health. And the two panelists were Frances Cress Welsing, before she passed away, Welsing, and Dr. Everett Moon Parker. And Dr. Parker, during that brain trust, said something that I will never forget, that when we think about the psychological distress and toll that African Americans experience compared to whites, and that's across the socioeconomic strata, right? So those of us who are working in professional fields, those of you who are legislators and elected officials and staff in a very high stress environment, there's these daily ongoing stressors that we encounter. And so this serious psychological stress can be found not just among poor. We often tend to think about health disparities and poor health outcomes within the context of those who are on the lower end of the socioeconomic strata, the poor, those who are impoverished. But that's if you look at certain indicators, you'll find that's not necessarily the case. And so serious psychological distress is reported across the socioeconomic strata, but for different reasons, right? And Dr. Everett Moon Parker said that we don't suffer from PTSD, which is post-traumatic stress disorder in the African American community, but really what she coined as DOTS, not post, but daily ongoing traumatic stressors. And then, of course, there's other researchers and scientists who have looked at this and who have also looked at ongoing traumatic stress as well. So I think that's important, and I will sort of tie that later when we talk about self-care and the impact of stress. In 2017, suicide was the second leading cause of death among African American youth between the ages of 15 and 24. And then the death rate from suicide for African American men was more than 4 times greater than for African American women. However, it is important to know that overall, our suicide rates are much lower than the non-Hispanic white population. But what is important for us to watch and to monitor are the trends that we're seeing. Even though it's lower, we're seeing, according to a report that looked at data from 1980 to 1995, the suicide rate among African Americans ages 10 to 14 increased by 233%. As compared to 120% of non-Hispanic whites. And then there are some who are looking at death by suicide by cop, looking at some of the justice-involved population outcomes as it relates to death and as it relates to this sense of hopelessness. So that takes me to the next slide. So even though we know when you look at some of the more common mental health indicators and diagnosis as presented in what is referred to as the Diagnostic Statistical Manual, so the DSM-5, it's the 5 iteration of that or version of that. We may not see among some of the more commonly known diagnoses bipolar disorder, schizophrenia, and so forth, we may not see our numbers as high compared to other race and ethnic groups, and that can be for different reasons. But what we do see where we are these affective kinds of disorders, right? This feelings of sadness, hopelessness, worthlessness, or that everything is an effort. So research has found, and this is summary from the Health Statistics National Health Survey, that African Americans, non-Hispanic Blacks, are 1.7 times more likely to report that they feel sadness compared to whites. We're 1.1 more times likely to report that we are hopeless, and 1 more times the ratio of whites and compared to blacks blacks compared to whites who feel worthless, and then 1.7% more likely to report that we feel that everything is an effort. And it is estimated that, with these even feelings of hopelessness and worthlessness, even with the high suicide rates among our kids, we are still less likely to get help and to be in mental health treatment. So it is estimated that only 1 in 3 African Americans who need mental health care receive it. And we know that this can be partially due to stigma and the lack of access to care are some of the contributing factors. And then also the way in which we deal with trauma, the way in which we dealt with setbacks, the way in which we dealt with challenges, oftentimes is to turn to our faith. And so even though it's not so much so now, it's becoming more common for houses of worship or institutions of worship, places of worship and faith institutions to acknowledge mental health, professional mental health as an important part of a ministry. For so long though, we thought we responded saying, we'll just pray it away, right? Just pray for me. If I could just get my mind right, y'all pray for me. And I, so I'm in the South, and I grew up in a Pentecostal church where we had testimony service. And the seniors, the elders in my church that I grew up in, I'm now Baptist, but same types of things. I remember the elders saying, I want to give honor to God and thank the Lord for my life, health, and strength, and being clothed in my right mind. So our ancestors and our elders in our community often turn to faith as a way to respond to some of what we now know were probably diagnosable mental health conditions. Next. And there are risk factors that make us more likely to experience mental illness that goes undiagnosed and also untreated. Trauma, and what we also refer to as ACEs, adverse childhood experiences, abuse, violence, sexual trauma, generations of sexual trauma, generations of abuse, and again, part of the cultural experience of you don't tell what's going on in this house, you just take it to church, you pray about it, you don't talk about it, and so forth. And so through generations, internalizing trauma has become somewhat of a cultural norm. And we're finding, as we see with other influences and risk factors now intersecting with that. So being in a house where you can't go out because of shelter in place guidelines or social distancing guidelines and so forth, people are having to reconcile and have to kind of deal with some of the trauma and some of the effects of that trauma on their mental health. And then mental health conditions can also be caused by brain injuries, substance use, stress and worry, which I'm going to focus on today as hopefully helping us to build and strengthen our self-care strategies and tools that we use. Chronic health conditions, right? So just being sick, Also, you know, dealing with illnesses, right? Having to go to dialysis, having to take family members to dialysis, all of those kinds of things can contribute to poor mental health outcomes. Lack of sleep and poor diet. So the three that I really want to we'll lift today in our self-care. Mental health self-care for persons who serve the public are those three: stress and worry, together, sleep, poor diet. And then of course there are genetic factors and environmental factors such as toxins. We really don't know, and we have not invested enough funding in studies that look at the long-term psychological effects and impacts of communities of color that have often, which are often in close proximity to some of, landfills and toxic waste sites and dump sites and poor air quality. I think about the people in Flint. We don't yet know the long-term implications of having on our mental health, and even physical health, let alone mental health, of being in environments with poor, toxins and poor air quality. Next slide. And so what I want to talk about is really stress, the effects of stress, and encourage you as servants, as public servants, as those who have committed their lives and careers to really taking on the challenges that other people encounter, the problems that other people face, the burdens of really championing the causes of the poor, the causes of marginalized populations and so forth, is to really pay particular attention about how much stress you are taking in and how much stress is affecting your body, right? And when we think about the effects of stress, we know that the stress hormone cortisol releases throughout the body and can affect our immune system. It can cause our immune system to be suppressed, which makes us particularly vulnerable, again, to viruses such as COVID-19 and the coronavirus. And so compromised immune systems are one. And it's not just, people often think about HIV when they think about compromised immune systems, or they think about, sickle cell or other things that kind of, lupus and other diseases and illnesses that can compromise our immune system. But stress is a silent, killer in a lot of ways, because it can exacerbate existing health conditions, or it can cause health conditions that were not presenting themselves before. So stress can affect hair loss, hair growth, alopecia can be triggered by stress, a form of alopecia. We can have brain chemistry can change as a result of stress. We can have all kinds of diseases and all kinds of illnesses, joints. People talk about it, I don't know if I have fibromyalgia or rheumatoid arthritis or whatever. And I often say, well, what you want to do is do a stress check and figure out, are you under a lot of stress? And is that the time when your joints are hurting the most? Is that the time when you are getting dry mouth? Is that the time a lot, or that you have problems with your throat, with your voice, and so forth? Do you see yourself, your hair shedding during that time? Does your brain feel kind of foggy? And these are all things that I think it's important for public servants, no matter what position or role they play as a public servant, really should be mindful of in terms of taking care of ourselves. The main culprit is minimizing and reducing as much stress. And I used to, when I teach this, do different courses, women's groups, I've done this in churches and largely in women's groups. And one of the things I always say, and I carry into each presentation on the effects of stress and how we need to minimize it and how it can affect us, is, people used to say, well, you're not going to worry me to death. Well, guess what? People can worry you to death. And so bit by bit, there can be this weathering effect right? That's ongoing stress can slowly over time cause degenerative illnesses and diseases, right? So it can weaken your immune system over time. That creates other problems, all kinds of digestive problems, right? Chronic burping and flagellants and so forth. Some of those, yeah, we talk a lot about bad bacteria in the gut, and the gut has a direct line to the brain. But most of that disruption, that overgrowth of bad bacteria and so forth, can be triggered by excessive stress as a result of the over releasing of stress hormones in the body and not producing enough antigens. Next slide. And so with COVID, we know that the risk factors are the pre-existing chronic health conditions that I talked about: hypertension, diabetes, COPD, asthma, right? But most importantly, a compromised immune system. And so if you're not getting enough sleep, if you're not having an adequate diet, if you're putting in all of these hours and you're not taking time to practice good self-care, then you are at a particular higher risk for contracting COVID-19 if you come in contact with someone who is infected. And not only are you at higher risk of contracting COVID-19, you're also at higher risk of your condition worsening or taking longer for you to recover from it with your immune system compromised. And then, of course, being an essential worker and not being able to work from home. I found this data that was particularly interesting. It was released a couple of weeks ago, and it was on all the major cable news networks that looked at, using the Bureau of Labor Statistics data, it looked at who's most likely to be able to work from home. Well, I know you knew immediately off the bat without me even asking who that is. So those who are less likely to work from home are African Americans and Hispanic and Latino workers. And then, of course, environmental conditions and your age also places you at risk. Next slide. And this is just that slide shown in a graph format. Next slide. And so what I really want us to pay attention to as we continue to do the very important work that we're doing is doing a self-check and making sure that we are, no matter whether it's in quarantine or not, that we're doing things that can contribute to the 8 dimensions of health and wellness. And this has become a very popular and commonly cited, often cited reference that SAMHSA really pulled together, synthesized research, and really looked at different models, did meta-analysis based on meta-analysis and different studies that have been done. What are the things that are essential for people to live healthy and well? And health and wellness go hand in hand, but they're not the same thing, right? And so financial, making sure your financial house is in order, so to speak. Intellectual, making sure that you're always stimulating your mind with healthy things. So I tell people who have children and who are allowing them to stay on electronic devices, that is having a very negative effect on their intellectual well-being. It's not stimulating the brain. It's not stimulating the mind. In fact, it really is killing brain cells, right? So it sounds cliche-ish, or it sounds like, a mother's overreacting, but it really is. And it does it for us too. So if you're on your phone all the time, if you're on the computer all the time, which we are a lot, I think this is my 4th web-based meeting today. And so, it's important that we are doing things that are feeding our minds, feeding our brains, unplugging for, and I know all of us feel like we can't because we're in critical positions where people need to reach us. Well, if you're not healthy and well, you're not going to be able to last in the long run and be of service in the way that our communities deserve you to be. And so looking at all of these 8 dimensions, our occupations, the kind of jobs we have, are we happy and fulfilled in the jobs that we do? And I think public service, in a way, is fulfilling and brings joy, unlike other professions do. And then our social environment, who we have in our network, right? Are they affirming us? Are they pouring into us? Are they lifting us? Or are they taken, right? Are they exhausting every bit of energy that we have, right? Is it taking all of our strength to just deal with them? So really figuring out who's in the social network. Even when we use social media, right? Whose pages are you going to? Is it the folk who have all the drama and, you know, the sensational stuff? Or are you going to pages and following people who are giving life-affirming messages and things? Or are you following people who make you feel worse about yourself, or who you compare yourself with? And that can create all kinds of psychological distress. And then, of course, physical activity, making sure that we are moving our bodies. Bodies at rest stay at rest, and anything that's not moving is dying. And so making sure, even if it's just getting up and walking, pacing. We used to say, don't pace. Well, actually, pacing is pretty good. Well, teachers used to tell you, or parents, stop doodling. Actually, studies have found doodling is pretty good. So moving your body and moving your mind, being creative, and also moving. And then I talked about the environment, of course, our spiritual, our faith in something greater and bigger than us, and knowing that, as they say, this too shall pass. And then, of course, our emotional health. So although those are 8 dimensions of health and wellness that I encourage you, as you're doing the public service, as you're serving public servants, as you are staffing the important work that our elected officials are doing, or you are an elected official yourself, it is important for you to stay mindful of these 8 dimensions. Next slide. And so with stress, I came up with through some of my research and work with women, qualitative work, these stress management practices, really looking at what was common across all, health and wellness gurus. And so I actually came up with the SOAR method, the SOAR, rising higher, sort of connected to one of our HBCUs that I got my master's from, North Carolina Central Eagles. And so Eagles soar, right? So soaring above all of the stressors, financial stressors, family stressors, jobs, and so forth. There are certain techniques that work, and I encourage you to apply them. And another, being mindful of the effects that stress has. So these stress management practices. One is to stop, observe, assess, and respond. So oftentimes we respond first to the stressor, and what that does is it creates the stress. It activates the stress. So any stressor or stressful event, the very first thing you want to do before you even respond to it is stop. Just stop and observe what it really is that is happening. I am naturally oriented to be very, high energy, assertive, aggressive at times. And so my natural orientation is to respond. And that's when I'm not gonna say all Hades break loose, but within my body, but that's when I can feel the cortisol, I can feel all of the stress hormones releasing, because it is triggering that fight or flight response that we are innately made up to respond to stress, right? So it's a fight or flight mechanism. And then I have to calm myself down and so forth and so on. So it's actually the reverse that arrests or stops the stress from having the effects on your body that it has. So the reverse is the stop, and then observe it, assess it. Because oftentimes by the time you stop and you look at it and you really see what's going on, or who's happening as much as what's happening, that person probably really isn't, once you stop, observe, and assess it, worth the energy and the stress that is released in your body, and the effects of that, had you done it the other way that we tend to do. And that's the response first. So do it in the reverse, that stop, observe, assess, is this worth what I'm getting ready to lose? Because you lose something, the effects on your brain, on your muscles and so forth, that's a deficit, that's a loss. So is this worth what I'm getting ready to put my body through by being stressed out about it and then respond? And that takes practice, because you leave a meeting, you leave a committee meeting, and the most crazy stuff was said, or somebody was just such that person, and the immediate thing is to go and throw, I can't believe, let's get out, right? So that's it. No, stop. Okay, so I know how I need to deal with this, right? You take time out and breathe. Exercising, walking is a miracle worker. Jesus walked everywhere he had to go, they say, but I mean, walking is amazing. It releases healthy endorphins and things throughout their body that helps to rebuild some of the deterioration that has been caused by the effects of stress. Assess other behaviors in figuring out where you are. Do I need to just check out for a minute before I really check out forever? Am I eating right? Am I sleeping right? And am I getting water? Water flushes the toxins that are released by the stress out of your body. And so you want to make sure that you're getting enough water, not tea, sweet tea, or unsweet, or Arnold Palmer's, or Coca-Cola, or Pepsi's, or whatever, Dr. Pepper's, Sprite, whatever, not water. Flushing it through, it flushes out the toxins that are released by the stress. And then find your happy place. I know that sounds corny, or but think about people who make you happy. That's why people put up pictures of family members and grandkids and kids and girlfriends and boyfriends and whomever, because it triggers again another response in the body that has a positive, that releases the good hormones in our body. And then identify a C buddy. Now, I tell this at the church, and in the church presentations, the women's groups and so forth that I presented this at, I said, really, for me, a C buddy, in all honesty, is a cussing buddy. I hate to say it, but sometimes you can't say what you want to say in meetings. You can't say what you want to say when you are in professional work environments. So you need somebody that you can say that to. And so, but in churches, I tell them they probably want to call it a Christian buddy, or somebody, a care buddy, whatever works for you. For me, it started out finding a cussing buddy. Somebody that I could just, lose it and say what I needed to say and be done, and not lose, my cool in the presence of others in professional environments. And I've been in public work and spaces for long enough to know that I have a feeling some of you on this webinar also can identify that you need, it ain't a Christian buddy, it ain't a care buddy, it's a cussing buddy. Every now and again, you need somebody you can call and just say, I'm about to lose my mind up in here, right? So identify, find that person, because what happens is when we keep the mask on, we wear the mask that smiles and grins and hides all this stuff, whatever, the anger, the frustration, it too has an eroding effect, and it reacts in the body as a stress hormone. And so you need to get it out, even if it's going into the car and having an alter ego and just yelling it out. You need to get whatever. So when you go on retreats and self-care retreats, or you listen to these gurus, and they say, and some of the things is just yell, just scream and get it out. That's what that is, and that does have positive effects on our body. Next slide. And I think one of the main things I would encourage you to take from this is to have a self-care checklist. And it can be as simple as this. There are all kinds of versions online, and I have some links that I use that I found pretty useful, information from them, and they're credible and they're good, solid things that have been vetted. But you can make a simple checklist like this. Did you experience this today or this week? And it is what inspires you. So take a minute right now and just think, what really inspires you? And then you write that under what inspires you. And then you ask yourself, did you experience that today? Were you inspired today by that thing? Did you, or that person? Did you experience it in this week? You know, some of us say, last thing I need is something else I got to keep up with every day. Well, at the end of the week, go back to your checklist, and hopefully you begin to see where you are on this self-care. What fills you? What makes you fulfilled, wanting nothing more? And trust me, it's not money. You'll find it's not money. If it was money, Anthony Bourdain would still be here. If it was money, you know, all the people who took their lives at the top of their game, Kate Spade or you know, all these people, Whitney, chasing drugs and addicted to substances and so forth, trying to feel that pain and so forth. So clearly it's not money, right? Money is good, but clearly it's not that. So what have you ever had that feeling where you were like, I'm good, and I don't want to go there, but whatever that is for you, that you know what, I'm good right now. I'm real good right now. And then what motivates you, what brings you joy, what makes you laugh, and what brings you peace and calms you. And then just do a checklist. Did you experience any of that? I'm gonna rush through. Next slide. And these are some things that you can do, self-care, I say, on a budget. Things that don't cost much of anything. Walking outside on a local trail, downloading some old music and having that, creating a new playlist, doodling, all of these things. Saying positive affirmation, drinking a full glass of water, because like I said, it's more than just drinking water to keep you hydrated. It flushes all the toxins out of your system, decluttering your home, and Lord knows I need to do that. You know, making vision boards, preparing meals, learning how to cook, performing just random acts of kindness, and tricking your mind to not be impulsive and not to respond and eat from the ego. And that would be like if somebody cuts you off, if somebody, you know, isn't kind, if somebody is reinforcing a stereotype or a particular behavior of something, you know, if somebody's rude and obnoxious, racist, or what have you, doing the opposite of what the ego says to do. And the ego says, let them have it, you know, Miss Ann, you're not gonna talk to me like that. I don't take that from you know, right? The Oprah, the Sophia moment in the town square when the mayor's wife asked her to, you know, I said, you know, instead of having one of those moments, kind of tricking your mind and going the opposite way, it creates this sensation of joy. This is what we can think of as true joy. But this is a list that I'm leaving you with. Make a list of inspiring quotes. I have plenty. Next slide. And then I put this together to help some people and thought, you know, I'd like to share it. But, you know, combating COVID like a warrior, making sure that social distancing doesn't mean social isolation, checking in with yourself first. How are you? And if you're feeling like you need professional help, reaching out and getting professional help. Unfortunately, in our family, we've had my brother-in-law committed suicide, and my sister, when I was in undergrad at Carolina, was killed in a murder-suicide by her boyfriend. and then he killed her himself. And so, you know, I cannot stress enough, if you are not feeling right to you, whatever that means, please seek professional help. Don't be isolated, and staying in contact with people, calling folk you haven't talked to in a long time, practicing mindfulness, focusing again on your health and healing, and staying in a way, in a positive frame of mind by physical activity, at least 30 minutes a day, helping you. And then also helps, you know, when you're not gaining all this extra weight while you're closed in or sheltering in place, and doing your work the way that you do it. And then finding resources online that are very helpful. Joining one of those dance groups, you know, D Nice on Instagram, or, you know, all these DJs and so forth, or yoga or Zumba or what have you. But moving beyond your immediate space. Next line. I'm sorry, next slide. And so these are some really nice self-care resources. And I'm not sure if the links will work in this, but hopefully when you get the copy, these are some resources that are wonderful. That first one, you can find all kinds of fitness gurus. The second one is a self-care. It's a real cute blogger who does some really good stuff, and then Mental Health America. And one of my favorite online virtual psychiatrists is Dr. Tracy Marks. She does these quick little YouTube videos that are extremely helpful. She explains different forms of mental illness. She explains even things like compulsive shopping, where that comes from, compulsive negative talking. Some people can't shut their minds off. They're always reinforcing. And then AARP on their Voices page has really good resources for the Black community. But can you click, Wayne, can we open up the Fitness Guru one? Will it open, or will it take us out if we try to go in? I'm not sure how that works. I was on one time and it knocked out the whole thing. So maybe not, but hopefully at some point you all will be able to see that. So the next slide is next slide is the last slide for. Yeah, so with that, I want to thank you, and we can entertain questions or comments, but the next slide from there has my contact information if you would like to reach out and stay in touch. So Shauna, I'll toss it back to you, and thank you all for your time and attention, and hope you found this helpful.
Michelle, thank you so much. That was awesome.
Oh, thank you.
We appreciate you taking your time, and we plan to soar going
Yes.
forward, dealing with a lot of the constituents that we have to deal with. You know, we're not dealing with them, being able to work with them because they're just as upset as we are at the situation, not being able to get their unemployment, or they haven't received their check, or they weren't a part of the first $10,000 for the SBA loans, or their bank is not responding to them the way they want to. So, you know, they're just as, you know, upset as we are, but, you know, it's something we have to deal with. So we really, really appreciate you taking the time and sharing your intellectual property with us this evening as we soar. I do have a gift for you that I will come by your office with my mask and practice distancing to
Thank you.
On behalf of AALSCC and BCSL.
Oh, wow. Thank you. It was a pleasure. And I saw a question pop up about parents, and thank you all for your kind comments there. And
we're gonna open up with question and answer. After
okay.
Question. Okay. You can go ahead and ask that question. But if anybody else has a question, please raise your hand. There should be a raise your hand feature. If not, put it in the chat section. We'll make sure she sees that.
So the parents with the online learning, what I say, and my nieces hated this when I told my sister, my niece and nephew. So I told them, you make sure that, yes, you're participating in the required online learning that schools are offering or requiring, but go old school, go online, order workbooks, order book sets, and go back old school. So restrict their learning time online to the required structured learning that schools are requiring, or that homeschooling or what have you, the curriculum. And then the other half, so balance it out. The other half, have them writing in workbooks, have them reading, not on their phones, not on computers, but ordering box books. I became an avid reader when I got my first Nancy Drew and Hardy Boys books back in the day, and the whole box set came. And at the time, I was living with my mom. We were living in Newark, New Jersey, and I hated it. I was a country girl to my heart, and my mom was there at Rutgers, and I was a latchkey kid. So I had to be at home in the evenings by myself in this high-rise apartment building, scared out of my mind. And my mom, to keep me entertained and occupied, my mom I was always getting deliveries of stuff in the mail. This was long before Amazon Prime. So I say, go old school, go online, order them workbooks that they have to fill out, and also that's related to their studies. So that's a wonderful question about hereditary connections. So so the answer is yes, but that's only a small part, right, of some of the explanations for some of the mental health. Like, we know schizophrenia and there's a genetic component to that, but more so than hereditary, there's a whole area of research called epigenetics, and I encourage you to find out. It's fascinating. Epigenetics, it looks at the influence of the environment on gene expression. And so people say, I inherited that from that gene. We may have inherited a certain type of genes, or genes from genetic makeups from our ancestors. But what's interesting is the influence of the environment on that gene expression. Some genes can be dormant for a while and you won't see them, but then others can be triggered by environmental effects and influences. So epigenetics looks at that. It looks at the influence of the environment. And when I say environment, it's not just air, it's the whole ecosystem. So were you under a lot of stress? Yes. EPI genetics. It's a fascinating study area, field of research, and I think you'll find it quite fascinating, because it also looks at the impact of violence as a part of the ecosystem on gene expression. So some kids may have ADHD, a genetic disposition to certain types of mental health disorders, or on the autism spectrum, or what have you, and we see it exacerbated, or we see it manifested in a different way, and largely because we're thinking, those of us who are looking in this, or who are doing some work in this area of epigenetics, it's the influence. It's not the gene that's doing it, it's the influence of the environment on the gene expression, if that makes sense. So I'm not in, so there's some wonderful work that is being done out of North Carolina A&T, some research on Alzheimer's. Because what's fascinating to me, and this is not my area, so I'll just say what's fascinating to me about it, are Black women and the rate that we are being diagnosed with dementia and Alzheimer's. And I say it's stress. I say we worry so much, we stress out so much that and we already know that stress can, going back to the slide, can change our genetic expression as well as our brain chemistry. And so I think that there's a stress connection. But I would just encourage you to look at people who are doing that. I don't really know the answer to that. In terms of the genetic, we think that there is, and we know that there is. There's some research, but we don't really know how. The gene is responding, and to what, right?
Now, I'm hoping everybody is seeing the questions that she's answering in the chat section. And before you answer that next question, I just want to make sure I introduce Representative Billy Mitchell. He is our president-elect for the National Black Caucus of State Legislators. He's on the call, as well as Representative Gerald Neal. He is our NBCSL parliamentarian. I just wanted to give Representative Mitchell an opportunity to say a few words.
Shona, thank you so very much. I found this to be very, very informative, and please keep her contact information nearby, because we may have a broader audience for her to get this information, which is sorely needed. But thank you so much for your leadership in putting this together.
Thank you so much. Representative Neal?
Yes, hi, how are you?
Good, how are you?
Just wonderful. Let me tell you, that was a wonderful presentation. And I was sitting here just going through each of the points that you were making. Actually, I was checking myself out. but I also saw it as an opportunity to share this with my contacts and others. And I hope that there is a way to channel you through what I do. I'll get back with the office and you, and perhaps we can do that. But this was wonderful. And I deeply appreciate the work that you've done and what you shared with us this evening.
Thank you.
Yeah.
Awesome. She's going to answer the next question. And I hope Representative Mitchell and Representative Neal that you will stay for our next portion. We have a comedian to as a part of our self-care for this evening.
That's what I need.
That's right. Laughter is good for the soul. It's good medicine, right?
Yes.
Yeah.
So the advice I would give to someone who has a family member who may be showing signs of mental illness is to get that family member assessed by a professional, right? And so, now it's challenging with telehealth being the way in which medical treatment as well as psychological and therapy is being delivered. But that's the very first thing I would do, is because mental illness can be and it's not a bad thing, right? So get them to understand that we all need to check in with somebody every now and again, right? You don't make it, I'm convinced you just don't make it through this world without having some type of psychological distress or some type of, something that just tugs at you the wrong way and causes you to respond and think the wrong way. So one, talk to them in that way. Let them know that it's okay. And maybe even share your own personal story about, thinking about talking to someone, right? So we've got to destigmatize mental illness in our community. We have to stop using labels like, that person is crazy. I refer to things as being crazy. I don't refer to people as being crazy because it has such a negative stigma, right? And so, so approach them from a loving and affirming way and let them know that it's perfectly normal not to feel normal mentally and get them help. And so that's the first step, because the longer they are out of therapy or out of treatment or undiagnosed, the worse it can get. And it can manifest into other things like co-occurring disorders, mental health and substance use disorders. And you don't want that compounding effect. So that's what I would recommend as the very first step. And even if you have in here that they may not realize that they may be ill, you're absolutely right. I mean, they may not realize that they are ill, but if they're exhibiting signs that makes you think that they do need help, again, talk to them in an affirming way and say, hey, and even they may be fine with you talking with them to someone. So not leaving it up to them to talk to that person alone. And we want to respect their confidentiality and their right to privacy. So leave that up to them to make that decision. But if you feel like they may be resistant to being open to getting help, then you go with them. You walk that path with them and help them to get into treatment, or to at least be diagnosed or evaluated.
Okay. Now, we're going to have your slide presentation on our NBCSL website, and we'll make sure that Representative Neal and Representative Billy Mitchell will get your contact information because they want to stay in touch. So hopefully, we'll be able to use you again on some other projects really soon. So I have the BAT phone number. So we'll be able to get in contact with you. We want to thank you again for taking the time to be with us tonight and share your information. And for the attendees that are on, I want to, before I do that, I want to recognize Wanzina, who is Executive Director for NBCSL, and want to thank she and Wayne Roach, who is our IT specialist, for hosting us this evening and helping us get through this tonight. And if you look in the chat section, she's going to have some information just to visit the NBCSL COVID-19 resource page for more information and posting of the webinar materials for this evening. So we want to thank you. And now I'm going to turn the next portion over to our Vice Chair of AALSCC, Ms. Tanisha Woods. Tanisha?
Can you hear me?
Okay, I hear you now.
Okay. Oh my goodness, everybody. I am so full. Dr. Laws has taken me on a real good introspective situation tonight. And I just want to take this opportunity to say thank you. And now, for the reason that I'm talking to you all, I want to introduce a Chicago native. Her creative soul led her to grow and experience at Hampton University in Virginia, University of Georgia in Athens, Georgia. She landed in Raleigh, North Carolina as a classy, cultured, uniquely polished, and creative professional. It is my ultimate and great honor to present to you my soror, the amazingly talented Rebecca Jackson Artis.
That is way too exaggerated. I am not that talented, and I'm really not that funny. I always say I'm not really a comedian. I just don't know when to close my mouth. So I say whatever is on my mind. I speak stream of consciousness, and I think people just laugh at me because I'm way too quirky. Hello, I'm Rebecca Jackson Artis, and yes, I am a comedian, actor, and writer, and this has been a crazy time for me because as an artist, you know that a lot of times with comedy and with writing and with performing, you need the presence of people. And to do this virtually has been somewhat of a challenge. Also, I am a mom and a wife and a daughter, and I'm so excited to be around them all the time.
Mm-hmm.
So, and speaking of that, to be around my children and me all the time, as moms, we need our me time, right? And we always have to, we sneak off and we have our meals in the car with our special, treats, chocolate and things. So we don't have to share it with our families. But at the same time, we also have our me time where we just need time away from everybody. But I didn't realize that my children needed me time away from me. And so during this stay-at-home order, they have told me multiple times, Mom, I need my me time. So I guess I'm too much for them. So that's interesting that I have discovered that during this wonderful stay-at-home order. Also, what I've discovered are the power of deliveries. I don't know about you, but I get so excited. I've never been so excited about seeing the FedEx man or the UPS guy. I don't know about you, but I stand by my window when I come. I just want to say, hello, how are you? Oh my gosh, you brought something for me. And I know I scare them. I think I scared the last UPS guy. He literally ran back to his brown truck. And then I opened my wonderful gift because I'm so excited. It's so weird. It's amazing to get things by the door, and then you open it and it's like toilet paper, but you're so excited because you got a gift, and it might be toilet paper, but you got it. But anyway, so it's really interesting because even delivery from groceries and food, you're like, wow, they come up to my door for me. And then you realize it's so worth that $25 delivery fee for that $5 order. But you just are willing to pay that just to get the delivery at your door. But definitely, I know these Zoom meetings are annoying, and a lot of people are very annoyed by all this Zoom stuff, especially when people don't mute. We all have those, right? In every Zoom meeting, that one person does not mute. And we were like, it's been 2 months and you still don't know to mute when you're not talking? And we're trying to be very professional and deal with protocol, but you want to send them a private message and be like, mute. But yeah, but we have to be patient with them. We're still learning. It's a learning curve, isn't it? We also, have to realize that when we are on these Zoom meetings, we have to put on things called makeup and a bra. And it's like, wait, I'm home. Why do I have to look cute? And I know even yesterday, my husband, he had a tie and a shirt and a jacket, and at the bottom, he had on his basketball shorts. It was absolutely hilarious. But he looked very professional from the waist up. So that is something that definitely Zoom meetings have taught us, that we only have to be cute. But definitely what's really awesome about Zoom meetings is interacting with people we haven't seen in a very, very, very long time. And I know that there are people that I haven't talked to, my high school friends, I haven't seen in 20, 25 years, right? And we now are interacting on Zoom and keeping up with our families and our lives and our careers. And that's a beautiful thing. And also our family members who we haven't seen in decades, right? It's such a beautiful thing. And when my mom Zooms in her wonderful elder state, she doesn't realize that she has to have space for the camera. And many times she Zooms like this. Hi, hello, why can't I see them? Why can't can I hear them? And it's like, Mom, first of all, and my mom for some reason thinks Zoom means she has to scream. So she's like, hello, can you hear me? And it's like, okay, calm down, Mom. Normal volume. Put yourself in the frame. So a lot of people are adjusting to this Zoom stuff. But the great benefit of Zoom, and I know that a lot of people probably agree with me, is not being able to, or not having to interact with white people every day. It has been wonderful that I don't have to interact with white people every single day. My blood pressure has dropped, as well as my clinical depression. So I just want to let you know that is the blessing of all of this. Thank you so much. I'm Rebecca Jackson Artist, and I hope you have a great evening.
Thank you so much, Rebecca. Laughter
Wonderful.
does good, like marrow to the bones. Did you say something? Did somebody say something else? I thought I heard another voice. Was that Rep Mitchell?
It sounded
I
like
thought she was very good. Encore. We need an encore.
Thank you. Well, my encore I'll just bring my mom downstairs, and that will be plenty of hilarity. So.
Thank you so much, Rebecca Jackson Artist, for injecting some humor into our evening and our very, very busy lives when we're sheltering in. You would think that we would be, have a little bit more time on our hands, but it seems like since we've been sheltered in, we are working more. So yes, it is.
That's true.
That is so true, because I have to forward my desk phone to my cell phone now. A lot of these constituents who are calling now have my personal cell phone number, because you can only imagine the calls that I'm getting.
Oh, yeah.
So thank you so much for injecting humor into this. Is there anything else that anybody wants to say tonight before we close out?
I just want, if I may,
Mm-hmm.
I just want to say that that was, again, that was very enriching. And Ms. Laws, you can expect to hear from me and to further this discussion. Very impressive.
Wonderful. Thank you so much. We're gonna, before we close out, I have a door prize for.
I win? Did I win?
Must be me.
Not quite. It is a 4-hour executive coaching, and this goes to the person that was the first person on our call tonight, and that's Miss Tempest Boone.
Hey, thank you.
It wasn't Tempest, it was me.
I know we made a mistake. We missed you when you first logged in. We're sorry.
Yeah.
But thank you so much, everyone. We're gonna close out, and I want to thank everybody for coming tonight and taking time. I know you all are, and I'm using air quotes, zoomed out and WebinX out and UberX or a free conference call or whatever. But I thank you for taking the time tonight to join us. And our next meeting will be all staff meeting, and of course members are welcome to come as well. It's going to be on June the 11th at 7 o'clock. More details to come. It's going to be a meet and greet and happy hour and game night and little line dancing, just some more self-care as we continue and we hope not too much longer into the sheltering in and following the rules so that we lower the curve, and that folks in our communities are as you know, disproportionately affected. So we have to take extremely, extra caution as opposed to other people. So we want to make sure that we have some of that self-care and that we Huh? I thought I heard somebody else say something. Well, thank you so much, everybody. We're going to end the call today. We hope everybody stays safe and practice social distancing. And we will see you on the 11th of June.
Great job, Shauna.
All right. Bye.
Thank you. Good night.
Thank you, Shauna. See you later.
All right. Thank you. Good night.